So, for introduction to gastric ulcer, which is an epithelial tissue injury, this is the anatomical and the histology. So, today I'll talk about the simple columnar epithelium found in the stomach lining. So, these cells form a single layer that secretes mucus, acid, and enzyme. It creates a barrier that protects the stomach lining. So, in a gastric ulcer, this barrier breaks down, allowing acid and pepsin to damage the tissue. This causes inflammation, epithelial loss, and sometimes cell death. The body tries to repair using stem cells from gastric pits, but in chronic cases, it may lead to scarring or even perforation. So, the histological changes under the microscope, we see a loss of epithelial layers, and inflamed lamina propria, and possible fibrosis.
Gastric ulcer begin when the nerve control of stomach is disrupted, leading to the formation of submucous nodes. This reduces the blood supply to the area, weakening the tissue. As a result, ulcers start forming and are worsened by the stomach acid. Over time, the body begins to repairing the damage through the regeneration. Finally, healing completes with the scarring, but some tissue function may be lost.
Here, we see how gastric ulcer disease affects both tissue function and integrity. First, inflammation and erosion in the stomach lining will delay food passage. Second, damage to the mucosa reduces protective mucus, allowing acid to harm the tissue. Third, acid regulation and enzyme secretion are disrupted, leading to poor digestion. Lastly, severe cases may result in perforation in stomach lining, letting infection leak into the abdominal cavity, which can be life-threatening. All these effects impair normal digestion and compromise stomach structure.
For the treatments, we have proton pump inhibitor. It is to reduce the amount of acid produced in the stomach. Next, we have antibiotics. Some patients might have a side effect like diarrhea. Third, we have H2 receptor antagonist. It also to reduce the amount of acid but work differently than PPI. Fourth, we have antacids like alginates. It is to produce a protective coating for healing. And lastly, we have lifestyle. We have to avoid the alcohol, smoking, spicy food, and stress to support recovery.
Peptic ulcer disease or PUD is an open sore in the stomach, duodenum or esophagus caused by acid damage as explained by Berida in 2022. The two main causes are Helicobacter pylori infection and long-term NSAID use like aspirin. Other risk factors include smoking, alcohol, stress, and genetic factors. The disease happens when there's an imbalance between aggressive factors like acid and H. pylori and protective factors like mucus and bicarbonate. Treatment aims to relieve pain, heal the ulcer, eradicate H. pylori, and prevent recurrence. The first-line treatment is proton pump inhibitor with antibiotic for 10 to 14 days along with lifestyle changes like stopping smoking, reducing alcohol, and avoiding spicy foods.
A recent study by Renhauni and colleagues in 2023 developed a composite biomaterial combining hyaluronic acid with the cellulose gastric extracellular matrix. This material was applied to gastric ulcers and showed promising results. It shifted macrophages from a pro-inflammatory M1 state to a healing M2 state, while also suppressing the NF-κB pathway. This change improved the immune environment, promoted epithelial regeneration, and significantly accelerated ulcer healing, making it a strong candidate for a future clinical use.